To be today. We have two coffee breaks, one in the morning and one in the afternoon. Both coffee breaks are on the back. The men's coffee break are on the top floor, the same floor we are on. For the ladies, if you go downstairs, there are also the ladies' room and the coffee break, inshallah. There are also men's and ladies' room outside the door you entered. This is just international lecturer. He is presented all over the world, especially in Europe. So without any further delay, please join me in welcoming Dr. Maxim Belograd.
Okay, this is not usual for me to have this walk, so I don't know where to stay. If I will be staying here, maybe people from the back will be not able to see me because of my time. If I will be going on the table, and it will not like that. Anyway, I will try to pay attention for I'm really excited. So, we will have a very interesting and intense day. We actually performed approximately the same program 2 days ago in Bahrain. It will be the full day about the Microvision anterior restorations utilizing composite resin dedicated to minimally invasive planning. And it was just an idea. This idea was put on the table and then transferred to the Facebook. And now we are about 25,000 participants all over the world. And the idea is like a fire, spreading all around. And we are really excited because of this kind of success. Now we have official members. They are the representatives of different dental fields, like surgery, endo, restorative, aesthetics, etc. from different countries. We are growing up. You'll not yet, okay? In the next maybe month, year, you will be a micro dental world. Okay, so the next question for these guys who raised up the hands. If you are using loop, okay, you are using loop stage, can you perform dentistry nowadays without loop? It's not easy, right? It's not easy because it's not because we are blind, because we are old people and we have some disease without visualization. No, there must be any kind of magnification can help us a lot. And from my point of view, in my career, There is no best material nowadays. There is an axiom that we have to keep the nature. And as you may understand, if you can control the process, the preparation, for example, you can keep the nature. And the benefit is that you can have your documentation without any interruption. That means you can work. Okay? So, but this is unfortunate that sometimes we make this decision, sometimes this decision according to the cost. Because of the time, it's much more easier to work this indirect capacity solution even without the laboratory. You can do this yourself. Indirect capacity, you can do it chair side. Dentin, then Ritz, then we have to apply the primer. Primer will go inside the peritubular surface and also inside the tubulars, and then you will apply the foam or adhesive. The adhesive is hydrophobic interface, and the long-term survival rate. Right. We have to have the cable. Okay. You will find the solution, or maybe we can find someone very strong in the room, the strongest man in okay. Like mesial defect, I will break the contact point just to show you how can we afterwards, how can we manipulate with the metric to create a new contact point here. Are really curious about the damaging of the adjacent tooth, you may use the thin bore with a slower speed rotation mode here, just to remove this horn. But the microscope is very interesting to manipulate because we can go for the high magnification. Okay, and you can be really precise. You can be really precise with a microscope here. Sometimes if you have still the problem, you may use in real life the scalpel blade or chisel or sharp excavator to fix it. And next you may use the disc in interproximal areas. But to keep our things more efficient according to the time, I will continue with the bore. Now I have to create some bevel effect. For this I am using the red one, the red flame bore. Flame one, I can be precise in interproximal zone where is the enamel. I'm working precisely on enamel side here. Okay, don't move your bore to the palatal. It is not necessary to have any bevel or chamfer at palatal. We may use this bore. We have to manipulate it with this. You know why? Because between these there are a lot of aprismatic enamel. The aprismatic enamel is not good substrate to bond. So you have to treat this aprismatic enamel. You can treat it with the disc or with a strip or with what? Microabrasion, like air abrasion, the aluminum oxide. Okay? Some rules. Don't use the disc and any polishing instruments on the dentin. Okay? You will create out of what? That was okay? The rubber wedges like yellow or orange, you can see like around it, and they're pretty much expensive, but if Dr. Riyadh will help me with it, you will have the same with your assistant. You will break your rubber dam immediately. So before you will proceed with the flossing, you have to open the adjacent tooth. You inside pull left up, not up and down, but forward and backward, and pull out. And the same from the others. So let's move to the orange filter. In the microscope you may find this orange filter. It will help you to keep the composite non-polymerized. Because now you can see that there is a lot of dust here. I will just clean the silicone with the bonding agent. But in the real life I will think about this. She immediately, or he, depending on what kind of assistance they have, gives you the material. We will and this is very important trick. Before I will get my silicone index inside the patient's mouth, I can make the adaptation of these two portions between each other, and I can be very confident. And again, some important information, I didn't mention this, I forgot. If you are pushing and pressing your silicone index, don't press on the place. We will have the mistake here. Give me the big one, like green. Okay. What kind of mistakes can be here? Just the material from the syringe, etc. Just immediately your assistant will give you, close this tray. Will give you the material. You see, for example, the progressive. Just take a look here. Okay, the flat, and then it goes to polymer. Okay, and ask your assistant to polymerize. So go for light cube. I can make focus. This is a secret information. That's why I'm all rough surface of the inside. Oh, now okay, okay, perfect. So you may use your disc also here to make. You have to dry it like this. Okay. Now.
Something like this in the vision.
Exactly.
Wow.
You have to be very close. Somehow the blue effect in between mammals. If you would like to play more, for example, I would like to have sorry, enamel. The final layer of enamel. We are going to have the final layer of enamel. All the enamel. You can have the problem. So spread your composite a little bit further the margins. If it's too much, just remove before. Okay. We have three options. The first option is to layer the surface, the final layer of the enamel, like I'm doing now. We can perform the surface. How? The layering. But be careful, if you are not accurate with the layers of your composite, once you will remove your rubber dam and look at the patient from side to side, because even this small anatomy can be destroyed during finishing and polishing. So this is one option. The second option is if you have the transparent silicone and you have the critical part. Now, can you switch to my screen? Okay, so before let's do like
course. It will be more intensive, more clinical, and for our members, we have a very special discount for today. If you sign up today, it will be 4,000 riyal. If you don't sign up today, actually, we have to use the regular price, which is 6,000 riyal. I encourage you to take this opportunity to excel our clinical skills and knowledge. The second point is we are doing our best to bring you the best speakers and to كده أنا أرجوكم رجاء الجميع في evaluation forms ستوزع عليكم أثناء البريك بعد الظهر. أرجوكم رجاء خاص للجميع. Feel free to write whatever you want. I know we had a little bit of the خلينا نقول نسميها problems this morning for registration لأن ما شاء الله تبارك الله الإقبال كان غيرت شعارها شعار الجمعية الهوية واستخدمنا شعارين اليوم علشان ما نلخبطكم. فالشعار القديم استخدموا جميع مجالس الإدارة السابقة لهم جزيل الشكر واحنا نعتبره نشان على صدرنا. ولكن مواكبة التغيير في العصر الآن اخترنا شعار جديد ونحتاج your feedback. Any comments? If you have any comments, any suggestions, we would like to hear it from you. Write it رجاء في evaluation forms. Lastly, Zeiss وآيبوكلار وديجيتال ديجيتال لاب. أيضا الشكر الجزيل لدنتال تيوب دي ما شاء الله عليهم قاعدين they are documenting everything for us. نيابة عن الجمعية السعودية لطب الأسنان أتقدم لهم بالشكر الجزيل.
من شركة زايس حسام أبو سعود. يزيد مازن. دكتور شادي المدني. دكتور محمد جمعة. دكتور فراس عسكر. محمد نور. غادة سعيد. ودكتورة نور الأسعد.
And look at for processing next step. Okay, as I promised, we are going now to have the finishing and polishing protocol step by step again, and I will mention some important information regarding the speed, regarding the pressure, what kind of effects you'd like to have, what type of the Okay, so it can be like a first step. The second step will be the definition of the planes. So if you are restoring one tooth, you have to take a look at the adjacent one and to copy, to duplicate the same planes that this tooth have. So you just have to take a look at the equator zone and the cervical plane. Then you may find the middle one is totally flat, okay? It's totally flat, so that means that I can duplicate a little to increase the process of finishing in certain areas. Okay, now will be the next step. And as you remember, the next step is transitional angle lines. So, how to define the transitional angle lines on the adjacent tooth? It's very simple. If you just take a look here, you may see the and this from this to this side. Okay, I have to have the same. So this is the native zone of the tooth, and I have to proceed in order to get the same distance here. So this part, this one, should be dragged. Okay, I have to create a shadow effect here. I can do it with the board, so I can proceed with the same board. Dangerous to proceed with the board because you can destroy the adjustment. So the trick for this situation is next. I will show you the trick with this situation. Okay? For sure I will switch to the disc because disc is much more thinner. Okay? It's much thinner, so I can control by the disc, the highlight zone. Okay. But anyways, some now I can reach this zone with the disc with a very gentle press. Okay. If I would like to make the transition exactly to the interproximal, very polite and gentle and smooth, this is the trick. First, you may use the wedge. It is some painful to the patient. If you don't like the patient, you can push the wedge more stronger. If you like your patient, you may like a more strong version, we can create very interesting and specific design of the rubber. Okay, you may use the same one. Like this. It can be called like a magic rubber. Okay, so basically we have to have 4 frontal pictures. Just normal face, rest face. We can find the information about the face type. Okay, the picture when patient is relaxed and has semi-open mouth, just to see the display as we mentioned before. Maybe you remember at the beginning of the presentation, the normal smile and the wide smile. Sometimes not normal, not typical. Artificial smile. This will help us to understand the buccal corridors, and also it will help us to understand if patient displays the soft tissues during the smile. Okay, and close up. If you have good camera, like for example full frame camera, in the good information, you may analyze the video, and then you may play the pausa. You have the still, you have the picture, and you can analyze this. Okay, next is the profile pictures. These two 45 degrees pictures when patient is smiling, very important for us in order to have the information regarding the position of the teeth related to the vertical spin. Sometimes you may find the teeth are vestibularly located, sometimes they are inclined. So this is also nice information for you, and you may understand, for example, in this case, just take a look on the right side. In this case, if there will be the case for veneer, for example, or lumineer, okay, you have enough space to add. It's not necessary oral, intraoral. This is very useful retractor. If you will find this retractor on the market, you will be very happy. This is from the Ultradent. The Ultradent, this one is very useful. Your patient can retract himself. Okay, why it is necessary to retract himself? If you ask for your patient, for example, just take a look at the lower side, left and right. This is the picture from side to side. That means you have to retract one side. You ask your patient to retract as much as it possible, and patient can control the pain. Sometimes you ask your assistant to retract, or you do it yourself. And sometimes your photo session will give your patient certain understanding that you are not his dentist, because you retract too strong, you break his mouth. The frontal with contraster from side to side with contraster. Occlusal view, you will have to have all the information about the jaws, upper and lower, and also 12 o'clock picture. 12 o'clock picture is nice to understand the position of the teeth according to the vertical spin. Just let's take a look for this protocol here. Okay, you can have the upper and lower full arch, and this is the 12 o'clock picture. You may understand the position of the teeth according to the vertical spin and the relationship between teeth and lips. Okay, this is normal situation when you have more or less normal position of the teeth, and you can go for this kind of the mocha. What if we will have this situation? We have the rotated teeth, or inclined, or some tooth is outside. Okay, so what should we do with this kind of the situation? In a logical way, your dental technician, once he has the cast model, okay, so we can start?
Yeah, go.
Hello everyone, my name is Maxim Belograd and I'm a dentist from Ukraine. I'm a co-organizer of the Microvision group and it's a big honor and pleasure for me to be here in Riyadh, Saudi Arabia for the first time. Actually we have now a very interesting project here, full day with the Microvision. This is the course dedicated to the restorative dentistry utilizing composite and ceramic veneers, and the program is very intense. We are discussing a lot of questions related to the composite restorations, minimally invasive restorations utilizing ceramic veneers like prepless, prep veneers, minimally invasive preps, etc.